afternoon. So my colleague spoke a fair bit about the direction that he believes that healthcare will move in the future. But I would like to really dwell a little bit in the past and a little bit in the present for everybody to understand why and how the future is going to shape up. Let us look at the history of healthcare in India. We started off primarily by allowing government hospitals and private charitable hospitals and medical colleges to provide care through the length and breadth of this country, effectively for many years after independence. However, it became clear that the government itself could not and would not be able to continue this as the population grew and as the aspirations and the economy of the country improved. This led to the emergence of private healthcare in the 80s, which is here to stay today. Today, in India, nearly 70% of healthcare is provided by private healthcare players. But the major difference is that whereas government and charitable institutions provided care at a level that was social commitment, private healthcare looks at healthcare being an industry. And this is a fundamental difference and change that has come and established itself. Therefore, the cost at which healthcare was delivered has also changed and moved much more in the last few years. Added to it, which my colleague alluded to, is the fact that technology is required for the provision of healthcare today. And as more technology comes in, the cost at which healthcare is provided increases. So we are in a paradox. We are still one of the lowest in terms of healthcare costs in the globe. But for a nation that is emerging, for a large percentage of our population, there is a disparate and an inability to afford the healthcare at the costs at which even India is providing and the cost at which private healthcare is providing. Bridging this gap is important and perhaps will be the answer of the future. The government aims to do this by creating public-private partnership. And while this is certainly the way forward, there is a trust deficit between the parties involved in this private-public partnership anywhere. And that gap is still not bridged. Bridging this gap implies that two things have to happen. One, private healthcare has to understand that the margins of profit with which they work can no longer be applied in the long run. And the government has to understand what is the cost at which healthcare is provided. Because all of us understand that we cannot go below cost because then the industry becomes unviable. And this is the deficit and the gap that exists and continues to plague and also prevent healthcare from moving at a faster and a more brisk pace, which is so essential for the country. Bridging this gap will happen, as it does in India. But the faster it happens, the better it is. Will it happen in the next year? My answer is no. Will it happen in 5 years? I certainly hope so. It is good for the industry, it is good for the people, and above all, it will elevate the health of the masses. As we have established private healthcare, insurance as a factor of financing the healthcare needs of the nation has also grown. There is certainly a penetration of private healthcare which definitely helps to service the healthcare needs of urban India, of corporate urban India, but also it is to be noted that middle class population which really requires it does not subscribe it to the extent that is required. This needle will move forward without doubt. And more people in urban India will realize that for their healthcare needs, they require insurance. Also discussed already is Ayushman Bharat, a fantastic scheme, no doubt, and perhaps the most ambitious in the globe, and certainly far-reaching and well-established in its form. Here too, there continues to be a gap, which I alluded to about the public-private partnership, and bridging this gap is absolutely essential. And I believe that the focus that the government has made to Ayushman Bharat and the manner in which private healthcare players are being involved in decision making will help move this needle much faster than it has been in the past. This also means that private healthcare now looks at high volume, low margin, care, which will allow them to continue to remain sustainable, but at margins which are much lower than what they are used to today. Investors also must understand the realism of what they can expect as returns from investment in healthcare. This means that the more we reduce the cost of infrastructure, the better it is. Let me quote some examples. Today in Colombia, Asia, which is certainly a hospital not for the masses, not yet for the masses, let me say that, because obviously we will have to change and we will have to understand that the needs of the nation are much higher than what aspirations a private enterprise may have, and move towards that requirement and satisfy the needs of the people and the government. But as it stands, caters to the middle class and upper middle class. Now, the cost of putting up one bed in our hospital is close to 1.2 crores. Imagine that if 1.2 crores has to be invested, then already you have a certain amount that you need to earn from that bed occupied for you to make ends meet, forget about making profit. And today, in a scenario where there is insurance and also people who are willing to pay, still it takes more than 10 years for the unit to become profitable. This being the case, you will understand that we have to really go down and at the cost at which we build hospitals, the infrastructure. And there, what I believe is more and more subsidies will have to happen and will happen in the future, both for land, for electricity, and other basic requirements of the hospital will have to be met with by various SOPs from the government, both tax and otherwise. This will be reality. Cost of medical infrastructure, as I said, because of technology, continues to grow. And this cost of medical technology is not going to come down. And therefore, there is a need for us to understand how low-cost medical technology can replace the high-cost medical technology. And here I will quote as follows. Currently, medical technology rests with the Philips and Siemens of the world. These companies cater to the requirements of the Western world, where the bigger, the better, the more expensive, the better is the way that medical science looks at technology. But for India, it is basic technology that is required, and that basic technology has to come at a cost that is much less than what it is today. Obviously, Make in India would be something that would be the answer, but, and there is a big but here, till to date, we have not seen the kind of quality and efficiency of Indian-made products that would satisfy the safety and accuracy needs and the efficiency that the medical fraternity seeks. And this is the other point that has to change. And like in India, everything changes but takes its time. This too shall change. The last point that I would like to mention is about the skill gap. Today, the gap in skill sets of doctors, nurses, and paramedical people is huge. And the number of doctors who are required exceeds 150,000 doctors in the country. And out of these, many of the specialists are required. Today, India has got the ability to produce doctors and specialists. But what happens? We export them, or we move them into urban India where they practice and are seeing a lucrative life in the comfort of an urban Indian city. Incentives to move such doctors from urban India to rural India has to happen. And this move can only happen if rural India develops in the areas of education, infrastructure, and once that happens, if there is adequate compensation, specialists will move. You must understand that everybody wants to live a life that is comfortable and also a life that enables them to bring up their children in an atmosphere that is appropriate. And if that has to happen, then the infrastructure that is required for children to grow up in an area that is good and an environment that is likable, and a family has areas to go for entertainment and other essentials of life is important. Do we have it in rural India? I think you know the answer. And as economy develops, that changes. There will be a move of specialists from urban to rural India, and that is absolutely essential for the success of healthcare, including Ayushman Bharat. Ladies and gentlemen, I have not dwelt on the areas that have already been considerably highlighted by my colleague. He used the word preventive health, and I'll modify that to say wellness, because wellness is even more important than preventing. Wellness is to prevent you from getting the conditions that will really be troublesome to you. And for the information of all concerned, the disease pattern in India has also changed as we have moved on from communicable to non-communicable diseases. Today, we are plagued with diabetes, hypertension, obesity, cancer, diseases that are not low in cost, and many of them that you will have to carry with your life and through your life in an expensive atmosphere. And wellness will help you to avoid these and the complications that can come thereof. We live in exciting times. Every part of life in this country is exciting, whichever way you look at it. I have seen it all, and perhaps more than anybody else seated here, because I can see that there is not enough gray hair in this audience as I have, or no hair that I have, which gives you an example of 5 decades of medical expertise in the country. And I know that I may not see many more decades, but I do know that the coming decades would be more exciting than what has been so far. Thank you for your